This is the most physically ill, mentally ill, and addicted population that we have ever dealt with.
That's Montgomery County Sheriff Rob Streck talking about the drug use problems that he's seeing. The sheriff, along with the Clark County Sheriff and Congressman Mike Turner, announced a plan in Congress to fix this. As News Center 7's Taylor Robertson reports, a big part of the plan would make it possible for inmates to get Medicaid.
Currently, if you are in jail, even awaiting trial, you lose your Medicare benefits. But a bill introduced to Congress could change that.
They're presumed innocent until proven guilty, but they come to our jails and then they lose those benefits.
The bill introduced to Congress is called the Due Process and Continuity of Care Act.
And if you have Medicaid benefits and you're incarcerated, even pre-trial, even where you've been convicted of nothing, you lose your medical care benefits.
Dayton Congressman Mike Turner said this not only puts a financial burden on the community,
but it also disrupts any care that the individuals are receiving. Opioid treatment, for example, or any medical treatment that they're receiving.
He said cutting off their benefits is a constitutional issue.
Because they are incarcerated, but they have not been convicted of a crime, and yet they lose their federal benefits that they're entitled to. Also, then the burden falls upon the local community. Our sheriff's departments are not set up to be able to step in where the federal government is providing a benefit and provide that benefit for those who are incarcerated.
Montgomery County Sheriff Rob Streck said this puts a strain on local jails.
Like many jails across the country, Montgomery County has seen a significant increase in people incarcerated with severe medical issues.
Both Sheriff Streck and Clark County Sheriff Deb Burchett said over half of the inmates in their jails have some sort of mental illness. And when inmates are taken off Medicaid, it's not easy to foot the bill.
Not only is it they suffer money-wise, our deputies, corrections officers that work in the jail, they suffer because these people have no medication. And so every day we're dealing with violence in our jails now that we would never dealt with before.
The Department of Health and Human Services will provide states with the funds to cover the cost for implementing this policy. Congressman Turner said this is a top priority for him, and he's hoping to get the bill passed by January. Reporting in Montgomery County, Taylor Robertson, News Center 7.